and we have some resident experts helping us out today. We have Liz Tyrell from Shepherd of the Valley, and we have Heidi Southworth, who's the Director of Nursing at the Montana Mental Health Nursing Care Center. So welcome everybody. Okay, great. We'll go ahead and just move forward. So the information that we are presenting is current at the time that we created the slide deck, but as you know, our situation is changing rapidly across this whole telehealth scene, as well as in the long-term care regulations that are occurring right now with the COVID crisis. So we're not having you mute your phones because we want you to talk. So for those that are attending, if you're struggling with something in particular, do not be shy. The whole point of this affinity group series is really just so that we work together to help each other. You know, when we all rise together, all, what is that saying about the rising boats or rising tide, whatever, you know what I mean. So we're really here to help each other increase capacity in the telehealth sphere, but also just to help each other and be kind as we learn and grow. So we have a couple of polling questions. Mary, if you want to bring those up. Aha. Just 2 polling questions, so we know who you are, our guest speakers. So, so go ahead and vote real quick. Are those not showing up?
It won't allow us to vote.
It won't allow you to vote. Oh, because you're panelists.
Yeah, with everyone as a panelist.
Okay, well, we'll close those. And let's just hear from our audience. Tell me what your biggest barrier has been. I see Deb Jorgensen.
Yeah, basically it's a combination of technical and logistical. We don't have phones in the residents' rooms, and so I bring a computer down to the room, and then the the nurse for the doctor calls, and so then I have to run down to the nurse's station to get the phone, and then I have to run back to back to the room, and it's just a combination of figuring that out.
That does sound like a lot of running. How about Maura? Is that how you say your name? If you're talking, you might still be on mute. Okay, we'll go on to Katie. Katie, what's been your biggest issue? Katie's also on mute. We've got some shy people. Okay. How about anything in chat? Feel free to also chat in. Okay, well, I'm going to move ahead. So what we're going to do is we're going to hear from our 2 guests about how they've successfully implemented telehealth in their facility. And so we just have some fairly simple questions about, you know, why they made some of the choices that they made, what kind of solutions they came up with, and things like that. So we'll start off with Liz. If you want to talk about what telehealth platform you use and why you chose it, what's, you know, how it's working, etc.
So we are actually using several different platforms because everybody in our community seems to want to use a different platform based off of what they feel meets their HIPAA regulations. So I think at the moment we're using a total of 5 different platforms. So we've really been at the will of the physicians because we really want them to be able to see their patients and rather than try to get them to conform to what we want, we found it easier to just download what they want. So we're using Zoom, Skype, FaceTime. There's one call, it's Inpatient, and Amazon Chime are currently the ones we've come across so far that we've had to set up.
Wow. Well, that's what you call flexibility, huh?
Yes.
Heidi, what about you? What are you using and why did you choose it?
We started out with Zoom and we found that to be pretty good. It was taking us a while to get connected. And normally in meetings, we really like Zoom here. We might even like it a little over Skype, but we were using that and I don't know why the connection started to get difficult. So we switched over now. We're using Google Meets, and thus far our health information manager and our staff have liked that so far. I don't know, is Eric on the line too, Eric Arzubi?
I don't believe he's on.
Oh, okay. So we work with that psychiatry group, and they ended up, we were going to use an iPad and or a laptop. We have Wi-Fi throughout the building, which is the key. I think that's why the first nurse or whatever was saying, you know, she had to run up and down halls, is because to me it sounded like maybe they didn't have Wi-Fi. And so that is pretty critical, is that you're going to want Wi-Fi. And then you can use a laptop or an iPad. And then we have, like I said, used Google Meets. And it seems like once you get used to it, it is pretty easy to use, and the connection has been pretty strong for us. And I think it was a preference for the psychiatrist too. So we're ready to accommodate, just like the last facility was saying. But they ended up sending us from their group an iPad, and we use that specifically for them. And on top of that, in that iPad, we also have some computer tests that we can have our residents do, and then they can evaluate that information as a psychiatrist.
Awesome. I'm going to go back to Liz. Just a question for you, since and our security expert Susan's also on the line. So just as a question for you, when you're using whatever the physician has set up, what are you doing on your end to ensure that regarding HIPAA? I mean, I know we're in the free zone right now, but that's not, you know, obviously the ideal.
Right. So our company actually has a really good IT team that's located remotely, and everything we use has to go through them. They have our computers pretty much on lockdown on what we can and cannot use and how they work and what will be allowed to pass through them. So it goes through multiple sources to check their HIPAA standards and all of that.
Okay. Good.
That sounds great, Liz. It's funny, that's Amber. I was just going to ask that same question. So also I'd like to say, just offer my services to the group. If you're ever concerned about HIPAA with all these different platforms, if you could just reach out to me, and I'd be happy to do a quick analysis. And then to Heidi, I really like the way that you guys have an iPad that's specific for that purpose. That's best practice. So nice job on that. And I do think Google Meets is a pretty secure platform. They actually sign a business associate agreement, which is very important. And so nice job. I'm hoping you like that platform, because I did a little bit of analysis on it, and it does have some good security controls in place. So like I said, anything to do with that, just let me know. Definitely we're here to help. So I just wanted to put that out there, Amber, if that's okay.
Okay. Our next question that we have is, of course, with every new program, there's always challenges. And in a nursing home, there may be some aspects of dementia with the residents. You know, why is my doctor talking to me through the TV? Or other kinds of things. So just, you know, what were your common challenges or just scheduling, like you said, running back and forth to, you know, connect the phone lines and you're getting your steps in and throughout the facility. So this time we'll start with Heidi.
So when we first started, like I said, with Zoom, what we did is we dedicated a room, which is a conference room, but we designated that as telepsych, basically. It has a big screen TV, and we were able to take a laptop and connect it in so that then the resident could really see him very well. And we had a couple weeks where the noise or the level of volume wasn't great, but it worked out really well. But now with changing over to the iPad and the laptop, we're kind of on the move a little more. We are finding a little bit of challenge with the hearing part. So we have ordered a Bluetooth speaker so that we will be carrying that with us for the residents. We also have, for our residents, just an amplifier that we could use for them that you just put the headphones on. And you should do that, you know, with any, you know, court hearing, care plans, or doctor's visits. You should really have like hearing amps so that they're understanding what they're saying. So we have those available too, but we're really hoping that the Bluetooth speakers will really help with that volume. But other than that, the things that we were worried about didn't happen. We have 100% major mental illness in our facility, and we have a lot of schizophrenic and that kind of thing. And we thought, boy, they're going to look at this and say, why am I talking to a screen? And that really didn't happen. I think our population is kind of used to using these formats. You know, we're using FaceTime more than we've ever have because of the COVID restrictions. And I think they just going with it. It seems like they're doing quite well. And the thing that we are really impressed with is the amount that the provider or the psychiatrists are able to get or see from our residents, the involuntary movements or just things that they say or the innuendos, that they're picking up on all of that. And so that has been a good surprise too, is that we felt like they're not going to see, you know, the movement changes or certain things. And boy, they really are. The things that we're worried about has not been a problem for our facility. We've been pleasantly surprised with that.
So do you have all private rooms? How do you ensure privacy of the appointment?
So no, many of them are double rooms, but we will go into their room and make sure that we can, you know, find a room on each wing if we need to, the dining room or wherever we need to. But the majority, like 90%, have been coming to our one room, and it's a conference room which just has, and we have a nurse and also a psych specialist that do rounds with the psychiatrist, and then we bring the resident in so that there is privacy. But if we have to go to their room, you will find a room on the wing, or make sure the roommate's not in with them so that they have their own privacy with the door shut.
Okay, awesome. Liz, what about you guys?
Some of the challenges.
Mm-hmm.
Okay. Really, like, kind of goes into before, one of the biggest challenges we really faced was all of our different physicians wanting to use different platforms and getting all those aligned and figured out at quickly enough, because our physicians were pretty eager to see our residents after so many canceled appointments and them not being able to come in, which is wonderful. That seemed to be one of our biggest hurdles. We have 2 designated tablets that are for telehealth use and only telehealth use. Those seem to work out really well. Again, with the privacy, we'll always ask our physicians, usually always start with getting verbal permission from the resident, and if they want a private area, we'll find a private room or something to accommodate them. But most of the time they're pretty fine in their room. I really thought that we would have a problem also with the dementia patients or psych patients and seeing people through the screen, but I'm also really shocked they're not very confused by it. They recognize the face and they're okay with it.
Oh, that's awesome.
Our tablets are, I really like that idea to order a Bluetooth speaker. We haven't had too much problem with volume. We have an iPad, and so far they've been able to hear pretty clearly.
That's great. I know the Bluetooth speaker was a godsend when I got it from my father for the TV. So yeah, that sounds great.
I have a quick question for Liz, if that's okay. Amber?
Oh, totally fine.
So Liz, is maybe the reason that you have, several apps, is it the provider's wish, or is it on the other side as well? Are you finding that some of the patients or the residents are actually looking to communicate over a certain platform? I'm just kind of curious how that decision is formed.
It's for the providers. We work with several different providers in our community, and every single clinic except for one wants to use a different platform.
Okay.
And we're
interesting.
luckily also to help out our hospital, Wyoming Medical Center, and several of our clinics got together and decided to use one, which made things really nice. And the rest we just figure out one by one as they come to us. Great.
Well, thanks for sharing that, but it's great to hear that the residents are adopting it, no matter what. So I think that's really cool.
They are. As far as, I haven't had any ask for a specific platform. On our rehab side, we have had some trying to do their own telehealth visit through their phones that they set up, and I usually end up called down to help them get through that. But
oh, this is great. Yeah, well, thank you.
Okay, let's go back to Heidi and just maybe share a little bit about some of the unintended benefits that you've seen so far.
Okay, well, in our facility, we had a live psychiatrist, and he was able to come to our town 2 days, about 2 days a month. And we had at the time over 90 patients, 95 was our average or so. And so a lot of the patients were only being seen by our psychiatrist about twice per year because of the load. We were able to get him to come more often, which was every 3 weeks. So it really didn't benefit too much. So now we got this telepsych in, and we were able to keep our in-house psychiatrist. He was able to choose a list for himself. He's still coming. And then we took the rest and gave them to our telepsychiatrist. So what they did was they built their own kind of EMR. Of course, it's HIPAA proof and all the right things, encrypted, et cetera. And we just sent over through ePass, and we're a state facility, so we have like an ePass system where everything can go encrypted through, and they were able to set up a way for them to receive it. And so we were able to send over, we don't have electronic charting yet here, so that's been a barrier for us. But so we were able to send over their social histories and, their recent psychiatric orders and just some information, and they were able to build their own little EMR for each patient. And we're able to see our telepsychiatrist now once a week. So once a week they take like 7 patients. So we have them built in groups. And of course I jinxed myself, and I told them when we first started was, you're not going to get a lot of after hour, phone calls, because over the last year or two, we've only done a few. And of course, the first day they started, we had to call them after hours. But the unintentional benefit is they're available. There's 3 of them in this group that will be including even more people. I think there's 4 now. We have set up Tiger Text on our charge phone and on a few of our administrative phones so that we can just Tiger Text encrypted to the group. And one of them will respond within, a certain amount of time. In long-term care, of course, for like medical, you have to have someone available 24 hours a day, which is our medical provider, but they really prefer if there's anything psychiatric that we have the psychiatrist available. And with our other provider, he had a practice, he has everything, office hours, so we were able to fax him and wait till the next day or else call our medical provider. And now we're able to reach out to them whenever there's a mandatory GDR or medication change, and we see a problem. We can reach out to their group and we get a response, within hours, and so that we can manage our healthcare of our residents so much quicker with that. So that to us has been amazing. Another area was our rounds that our doctors and psychiatrists have done before. They always called in there and just transcribed all of their notes, and then we would have to wait for that to be transcribed and then be sent to us, which could take a week or more sometimes. With the telepsych, they are doing their notes on the computer as they're doing their rounds, and they're done with their notation before their rounds or that person's done, and they're able to send those over to us by the end of the day. So we're getting notes in charts the same day of the visit, which has also been crazy for our facility and quite amazing on their part that they're able to do that. So that's been a really good thing for us.
That's a huge boost to just communication and knowing if there's a change in the plan of care or just, how things are going. That's awesome. Liz, what about you? Are there any other unintended benefits that you've noticed?
We've had quite a few unintended benefits. Me as being our medical records, one of the benefits that I found that really benefit me is we have a whole lot less paperwork. This telehealth really pushed us. Our system had the capability of e-signing orders and e-signing order summary reviews and all of those things that the doctor used to hand sign, pushed us into being able to use those capabilities. So now the actual paper that flows through the building is cut in about half.
Wow.
So that is a major unintended benefit that it's really good for Patrice and me and everybody. It's less errors. We also have the Tiger text, which has been wonderful. Our provider will see, our main provider sees majority of our patients, our medical director. So he'll see the people on the telehealth on the tablet, and then he's right there and he sends the orders right then and there through that Tiger text.
Wow. I had not heard of that. Is that something specific for long-term care or?
I don't know if it's with all platforms. We use PCC as Point Click Care as our main platform that we run all of our orders and do our EMR out of. And it started with that. You can write messages specifically just to different people in that platform, different nurses or whoever you need to communicate with, and Tiger Text links up with that. So if you need to monitor it not being logged into PCC, I can get those messages encrypted on my phone and, watch and see the comings and goings and making sure orders are getting processed. That's another unintended benefit is orders are getting processed faster.
Oh, that's great. What about our audience? Is anybody struggling with something that you could pick these wonderful gals' brains and help your facility out?
I see Mary has a question in the chat.
Oh, yep.
Is this requiring additional staff to assist with visits, and how are you managing that? Is someone assigned to the visits? That one actually is getting to be a big one, as we previously we were only doing 4 physicians mainly on our telehealth, but now I've got all of the other platforms set up for the other physicians. It is some days kind of running into what's the word I'm trying to look for? We're running into each other with the nurses. We pretty much have the nurses run it. We create the lists. I let the nurses know as soon as possible who and about what time the physician's going to be coming down to them on a tablet. And for the most part, that's worked out pretty well. We just have to link up transportation a little bit more so that we're not running appointments at the same time on the same unit, because then we're tying up 2 nurses.
Any other questions out there?
I was going to answer that too. That was our one of our worries too, was tying up more staff with telehealth or telepsych. And what we have found was we set a date, and we do Thursdays and a certain time every week. And if we're prepped and ready, we can get through these very quickly. Matter of fact, probably in half the time of an in-person round. And so we have assigned, you know, our supervisor, our RN supervisor, she usually does it, or me. I mean, we have a few other people that are ready and willing. Even if we take a social worker, sometimes they're trained to go with them. Of course, they can't process charts or meds, but they can at least go through it with them. But as long as we're prepped and we know if there's been any behaviors or any worries about medications, we have their labs ready if there's anything available that they need to know. But we also asked our telepsychiatrists that, you know, once they get to know our patients really well, can we add more patients to it and do it less frequently just for staffing? And they are more than willing to do that. It's taking them, you know, 2 to 2.5 hours to do our patients, 7, and like I said, in person and other face-to-faces have taken a full day. So they're a little more efficient, quicker, you know, able to get through your patients quickly, tie up your staff a little less, for a less amount of time than our face-to-face. So in the end, I think you start to see it even out in staffing.
I agree, if I can add something more to that. That's something we also did, is I had talked to our nursing staff on the floor and found out when there more of low times were in the day, if there were any. And our main physicians that see majority of our patients are set up at specific times in the week. So they know they can count on at 1 o'clock on Tuesdays, this physician's going to be rounding on a tablet.
Right. Yeah, I really, you know, I almost wonder with all this increased communication, if down the road, we might actually see some decreased readmissions because people are more able to, you know, get the doctors involved earlier and faster. So Crystal has a question. Is this affecting or setting back discharge planning? Usually liaisons are assigned from facilities to eval patients prior to coming, assisting with preparation to discharge.
And kind of just to clarify that, so usually home health will come, assisted livings will come up, in Casper, Elkhorn Valley would come up and just assess the patients, let them know what their transition would look like. So I guess is it how are you guys handling the no visitor and you know, still having successful discharge outcomes with smooth transitions? Or am I making sense?
Are you talking about discharging from our facility back to the community or discharging from the hospital to our facility?
Once they're in your facility, they're ready to discharge to another location. Usually, you know, and maybe the social worker's taken on that role to explain to them where they're, you know, what it's going to be like, what their transition looks like, or just kind of the liaisons would come up and kind of look at their function, look at, you know, talk to nurses, make sure that they're appropriate for that setting. So has that affected discharge planning at all?
On our side, the social work department takes care of majority of that, and I believe they're doing more conference calls so that and preparing the resident just verbally, since everybody can't come in our facility.
Well, for everybody else, we're getting near our time. We promised that these would only be a half an hour. So we really do want to hear your feedback. If you are struggling with a certain issue with telehealth or other related, any other kind of issues, we're here for you. We want to make sure our content is relevant and meet your needs. So feel free to always reach out to any one of us at Mountain Pacific. Drop us a line, complete your survey that will pop up after this event, and let us know what else we can do to help you in your care for your patients. So thank you to my guests. You guys were awesome. And I'm really proud of all the work that everybody's done to make sure that their residents are safe and well taken care of during this time. So thank you all.